10 early warning signs of osteoporosis you must never ignore. More than 53 million people in the United States either have osteoporosis or are at high risk of developing it. So what exactly is osteoporosis? It is a medical condition characterized by the weakening of bones, making them fragile and more likely to break. It occurs when bones lose minerals, such as calcium, more quickly than the body can replace them, leading to a decrease in bone density and structural integrity. Osteoporosis may occur in people of any age, but it's more common in older adults, especially women. Spotting the early signs of osteoporosis and getting prompt treatment is crucial and may save a person's life. In today's video, we will delve deeper into the 10 symptoms of osteoporosis that you need to be aware of to protect your bone health. Also, stick to the end of the video, where we will highlight the daily habits that you need to follow to avoid getting osteoporosis at an older age. Let's start. 1. Decreased grip strength. The decrease in grip strength in people with osteoporosis may be traced back to the weakening of bones. The bones in the forearm and hand, crucial for gripping, become more prone to damage and less supportive as osteoporosis progresses. This weakening disrupts the stable anchor that muscles and tendons need for effective operation. When muscles and tendons cannot attach securely due to deteriorating bone quality, their ability to generate force diminishes, leading to reduced grip strength. The body's natural response to pain or the fear of fracture may also lead to decreased use of the hand and forearm, a behavior that may exacerbate muscle weakness through disuse. This cycle of pain, avoidance, and muscle weakening contributes significantly to the reduction in grip strength observed in osteoporosis patients. In a study of postmenopausal women and overall bone mineral density, researchers found that low hand grip strength was linked to low bone mineral density. In addition, lower grip strength may increase your risk of falling. 2. Brittle fingernails. When someone has osteoporosis, their bones lose density and become more fragile due to a decrease in calcium content and other structural changes. This condition indicates that the body may not have enough calcium to support optimal bone health, and as the body prioritizes the use of available calcium for vital functions, such as maintaining heart rhythm and muscle function, less calcium is available for maintaining strong nails. When nails receive insufficient nutrients and minerals, they may become weak, dry, and more prone to cracking, splitting, and breaking. Furthermore, the physical manifestations of osteoporosis, such as changes in blood circulation and hormone levels, may indirectly affect nail growth and health. Poor circulation may lead to less nutrient and oxygen delivery to the nail beds, inhibiting healthy nail growth and strength. According to 2022 research, osteoporosis may contribute to slow nail growth, which may lead to the fingernails becoming brittle. 3. Unexplained back pain. Back pain in osteoporosis starts with the thinning and weakening of the vertebral bones. As these bones become more fragile, they are less able to withstand normal pressure or stress. This may lead to compression fractures, where the vertebrae collapse or crack under the body's weight. These fractures may occur with mundane actions like bending, lifting, or even coughing, and they might not always be immediately noticeable. However, over time they may lead to chronic pain as the damaged vertebrae affect the alignment and function of the spine. Moreover, spinal fractures may lead to a cycle of pain and immobility. Pain from the fracture may lead to decreased physical activity, which in turn may result in muscle weakness and stiffness, exacerbating the discomfort and leading to more pain. This cycle may severely impact a person's quality of life, leading to further health deterioration. In the study of 100 patients aged between 35 and 70 years, 83% presented with severe lower back pain. The incidence of osteoporosis and lower back pain increased with low body mass index, increasing age, and the duration of menopause. 4. Height reduction. As osteoporosis progresses, the vertebrae may become so fragile that they are unable to withstand the normal pressures of daily activities. The result is often a vertebral compression fracture. These are small breaks in the vertebrae that may cause them to collapse or become compressed. While a single fracture might reduce height slightly, multiple fractures may lead to a significant reduction in height over time. The reduction in height may also affect the space within the abdomen, impacting other organs and leading to various gastrointestinal and respiratory issues due to the decreased space for these organs to expand. Additionally, the psychological impact of height reduction should not be underestimated. It may affect self-esteem and social interactions, leading to a decreased quality of life. According to a study involving 2,108 women, a height loss of 2 inches or more is a highly significant predictor of osteoporosis at the hip. 5. Stooped posture. Osteoporosis often goes undetected, but sometimes there are visible signs. For instance, your spine might start to curve slightly, making you a bit shorter. Advanced osteoporosis may result in stooped posture, or what is often called a dowager's hump at the top of the spine. Back pain may result from this because of fractures in the vertebrae that cause the spine to curve. As these compression fractures accumulate, they change the shape and structure of the spine. The anterior, or front, part of the vertebrae often collapses while the posterior, or back, remains more intact. This asymmetrical collapsing leads to a forward bending of the spine, creating the characteristic stooped posture. This bending is not merely a cosmetic issue, it may severely impact the individual's quality of life. It may lead to chronic pain, reduced mobility, and even affect lung and digestive system function due to the decreased space in the abdominal and thoracic cavities. Moreover, the stooped posture itself may become a vicious cycle. As the spine bends forward, it shifts the body's center of gravity, increasing the strain on the back and potentially leading to further vertebral fractures. This may exacerbate the stooping, leading to more severe kyphosis. 6. Bone pain or tenderness. Osteoarthritis is the main cause of chronic bone pain. However, most of these patients are affected by metabolic disorders, such as osteoporosis. Severe bone pain caused by osteoporosis, when untreated or undertreated, may quickly lead to central sensitization. Thus, it may contribute to osteoporotic pain and its chronicization. The bone's weakening also changes the way forces are distributed across the skeleton. Normally, bones are structured to distribute and withstand forces efficiently. However, in osteoporosis, this balance is disrupted, leading to abnormal stress on certain areas, which may cause pain even without fractures. For instance, if the spine's vertebrae are weakened, they may compress, leading to back pain and tenderness. Moreover, the body's natural response to these changes may exacerbate the sensation of pain. The periosteum, a layer of tissue surrounding bones, is rich in pain-sensing nerves. As bones weaken and perhaps deform, the periosteum may stretch, triggering these nerves and leading to pain and tenderness. 7. Frequent bone fractures. According to research, bone fractures may increase your risk of disability or death. Hip fractures, in particular, are associated with a 15 to 20% increase in mortality within a year, especially among men. In osteoporosis, the internal structure of the bone becomes more porous and fragile, akin to a sponge with larger holes. This undermines the bone's internal support structure. Macroscopically, the overall thickness of the bone decreases. Combined, these changes make the bone more susceptible to breaking under pressure, from falls, or even from routine actions such as bending over or coughing, incidents that would not typically result in fractures in individuals with healthy bone density. Another factor contributing to the high frequency of fractures in people with osteoporosis is the reduced healing capacity of the bone. As the bone's structural integrity diminishes, its ability to repair itself after minor stresses or injuries is compromised, leading to a higher risk of complete fractures. Moreover, individuals with osteoporosis may also have other health conditions or take medications that may impair balance and coordination, increasing the risk of falls, which are a leading cause of fractures. Additionally, as one experiences a fracture, the fear of falling again may lead to reduced physical activity, which in turn may lead to muscle weakness and further increase the risk of falls and fractures in a vicious cycle. 8. Periodontal disease. The alveolar bone, which anchors the teeth in the mouth, is not immune to the effects of osteoporosis. Just as osteoporosis causes bones in the spine or hip to become weak and brittle, it may similarly affect the jawbone. As the density of the alveolar bone decreases, the foundation for the teeth becomes less stable. This instability may lead to tooth loss, which is a severe and direct consequence of a weakened jawbone structure. But the connection between osteoporosis and periodontal disease doesn't stop there. Periodontal disease itself is characterized by inflammation of the gums, which may lead to further degradation of the alveolar bone. Furthermore, inflammatory markers that are elevated in periodontal disease may contribute to bone loss. These markers circulate throughout the body, potentially exacerbating conditions like osteoporosis. A study evaluated 28 women aged 23 to 78 for periodontitis and bone density changes. Results suggest menopausal changes may lead to increased bone loss and tooth loss due to altered bone density and cytokine levels. 9. Early menopause. The core of this connection lies in the role of estrogen, a hormone crucial not only for reproductive health but also for bone density. During the reproductive years, estrogen helps to maintain bone density by balancing the bone remodeling process, ensuring that bone formation roughly equals bone resorption. However, as women approach menopause, estrogen levels begin to decline, disrupting this balance. Bone resorption overtakes bone formation, leading to a decrease in bone density. Early menopause, defined as the cessation of menstrual periods before the age of 45, results in a longer duration of life without the protective effects of estrogen. Estrogen helps in the absorption of calcium and other minerals into the bone, and it also plays a role in regulating the life cycle of osteoblasts, bone-forming cells, and osteoclasts, bone-resorbing cells. With reduced estrogen levels, the activity of osteoclasts increases, leading to faster bone breakdown than the body may compensate for with new bone formation. Early menopause is a risk factor for osteoporosis. Women with an early menopause should have bone density testing performed within 10 years of menopause so that osteopenia or osteoporosis will be diagnosed early and appropriate anti-resorptive therapy may be initiated. 10. Hearing loss. The inner ear contains the cochlea, a small, spiral-shaped bone filled with fluid and tiny hair cells that translate sound vibrations into electrical signals the brain may understand. This process is crucial for hearing. Surrounding the cochlea is the otic capsule, one of the densest bones in the body, which protects and supports these sensitive structures. The demineralization of bones due to osteoporosis could alter the structural integrity of the otic capsule. This modification might change how the cochlea perceives vibrations or how sound waves travel through the middle ear to the inner ear. The precise alignment and rigidity of the bones in the ear are crucial for sound transmission. Even slight changes may disrupt this delicate balance, leading to hearing loss. Moreover, osteoporosis may lead to changes in the blood supply to the cochlea. The cochlea requires a rich blood supply to function correctly, as the sensory cells within it are highly active and need constant nourishment. If osteoporosis affects the small arteries leading to the inner ear, it could result in reduced blood flow, depriving the cochlea of essential nutrients and oxygen. This deprivation may lead to the deterioration of the hair cells within the cochlea, resulting in sensorineural hearing loss. In a study from Taiwan, researchers found that people with osteoporosis had around a twofold higher risk of developing sudden sensorineural hearing loss compared to those without osteoporosis. This was especially true for older adults, women, and those with hypertension. How to avoid risk of getting osteoporosis. Avoiding the risk of developing osteoporosis involves several lifestyle and dietary measures aimed at maintaining strong and healthy bones throughout life. 1. Calcium intake. Ensure adequate calcium intake through your diet. Adults typically need between 1,000 milligrams and 1,200 milligrams of calcium per day. Good sources include dairy products like milk, cheese, and yogurt, as well as leafy green vegetables, nuts, seeds, and fortified foods. 2. Vitamin D. Vitamin D is crucial for calcium absorption. Aim for 600 to 800 international units daily, depending on age and other factors. You may increase your vitamin D levels through sun exposure, diet fatty fish, egg yolks, fortified foods, and supplements if necessary. 3. Regular exercise. Engage in regular weight-bearing and muscle-strengthening exercises such as walking, jogging, dancing, yoga, and resistance training. These activities help build and maintain bone density. 4. Avoid smoking and limit alcohol consumption. Smoking and excessive alcohol intake may increase bone loss. Quit smoking and limit alcohol to no more than 2 drinks per day. 5. Healthy diet. Eat a balanced diet rich in fruits and vegetables, which may provide other nutrients beneficial for bone health, such as magnesium, potassium, and vitamin K. 6. Limit caffeine. Excessive caffeine consumption may interfere with calcium absorption. Limit your intake of coffee and other caffeinated beverages. 7. Hormone levels. Low sex hormone levels may weaken bones. Discuss with your healthcare provider whether hormone therapy is appropriate for you. Each of these 10 signs represents changes in different elements of the body, such as the bones, muscles, teeth, and even the respiratory system, reflecting the systemic impact of osteoporosis. If you notice one or more of these symptoms, it's important to consult with a healthcare professional for a proper diagnosis and treatment plan. Early intervention may significantly improve outcomes and help maintain a better quality of life. Today we learned about all the symptoms that you may experience when you have osteoporosis. But did you know that there are other signs that your health might be at risk? Want to find out more? Watch 13 alarming signs your blood sugar levels are high. Or watch 12 early warning signs of heart disease your body is telling you about. You may watch either or both of them. Do you know any other symptoms of osteoporosis that were not mentioned earlier? Let us know in the comments section below.